Hi everybody, this is Dr. Hall and we're going to do the extensor muscles of the forearm today. So as you can see, I've already created a drawing on some foam board that I found in the basement of the skeletal features, and you're going to need to do this for your clay models because it's really important for us to understand the points of attachment for muscles, because of course muscles can only shorten with force, they can only contract, and if you know where they attach, their origins and insertions, then you know what the actions of those muscles are going to be. So you can just outline your forearm and hand, and so we've got the radius, of course, on the thumb side, ulna here with the olecranon, which is that olecranon process, the point of your elbow. You're also going to want to be sure to include the distal humerus, so we've got the lateral epicondyle on the radial side and the medial epicondyle on the ulnar side. Carpal bones are here. Metacarpals are going to be really important today, so go ahead and number those 1 through 5. That'll help you keep track of things. And then also, as we look out at the phalanges, you'll see that the thumb, right, the first digit, has a proximal and a distal phalanx, whereas all of the other digits have a proximal, a middle, and a distal phalanx. So that's a difference that we're going to see between the first digit and the rest. The other thing that you might want to do before you get started is to create a whole bunch of long strips of your modeling material because a lot of these muscles are long and skinny. So for the purposes of the video, so it wouldn't be half an hour long, I pre-created those muscles. So as we go along, feel free to pause the video so that you can have the time to actually craft those. So we're going to start with the deepest muscles, of course, right? And then we're going to build up. So first of all, let's just remind ourselves that on the posterior surface of the forearm, we are going to find extensor muscles. So just to remind you, extension of the wrist, right? In all these different directions, and extension of the digits. Right? So these are all going to be extensors on the surface because if you shorten this distance, these are the things that happen, right? You pull things that way. All right, so in our deepest layer, we're going to find 4 long strap muscles. The first one attaches to the ulna and then comes out and attaches to an interesting connective tissue structure called the extensor expansion of the index finger. So this muscle is called the extensor indicus. Indicus as an index finger, right? Allows you to do that. Pretty cool. The next one is another extensor. You'll find that's a common word today. So this one is the extensor pollicis, because pollicis means thumb. Extensor pollicis longus, and that's going to attach all the way out to the distal phalanx of the thumb. So the extensor pollicis longus is going to allow you to do that, right, of that interphalangeal joint. Now, anytime you have a something longus, you're also going to have a something brevis. And so our next muscle, fortunately for us, is the extensor pollicis brevis. And so this one's going to be shorter and attach to the proximal phalanx of the thumb, and it kind of sweeps out this way. All right, so this one is going to, since it crosses here, it's going to extend that joint there. I'm trying to do that without extending my other one. And then our fourth and final muscle is the abductor pollicis longus, and that's going to come down. It's a pretty big one, and it's going to attach to the first metacarpal here. So the abductor pollicis longus is going to abduct, right? This would be anatomic position, so moving away from the midline, abduct that first metacarpal. You can see the tendon kind of popping up there. So we have abductor pollicis longus, extensor pollicis brevis, brevis, sorry, extensor pollicis longus, and extensor indicus. So these 2 muscles are going to be interesting. We're going to see them later because they make some interesting landmarks, so keep those in mind. And so they're kind of special, and so I like to remember their names Abductor Pollicis Longus, APL, I think apple, and then I think of the phrase apple of your eye, and this is the Extensor Pollicis Brevis. So I just say to myself, apple of my eyeball, right? So here's your apple, here's your eyeball. So Abductor Pollicis Longus, Extensor Pollicis Brevis. We have another deep muscle of the posterior forearm, and that attaches from the ulna and wraps around the surface of the radius. This muscle is called the supinator. Its fiber direction goes like this, right? And so this muscle then, if you pull the radius over, that's going to supinate the hand, right? So that's our supinator muscle. And then the final muscle that we're going to do now is a deep muscle because it's deeply attached to the bones, but it's also readily visible when you do a dissection because there is nothing that lies on top of it. And it's this funny little triangular muscle called the Anconeus. And it attaches to the most distal surface of the lateral epicondyle and then comes out and broadly attaches to the ulna just below the olecranon process. The Anconeus muscle helps stabilize the elbow, especially when it's in extension, right? That's going to kind of hold that nice and tight. So these are our deepest muscles: Anconeus, supinator, apple of your eyeball, Abductor Pollicis Longus, Extensor Pollicis Brevis, Extensor Pollicis Longus, and Extensor Indicus. So now we're ready to move on to the superficial layer of muscles. I'm going to introduce you to this structure here. This is the common extensor tendon. The common extensor tendon attaches to the lateral epicondyle here. And then there are 4 different muscles that are going to attach to it, hence common tendon. All right, so the first one of these is going to be this muscle here, which is the Extensor Carpi Radialis Brevis. You may be like, oh, there's a brevis, there's going to be a longus. Yes, there is. We'll get to that one later. So this one is going to come down and it's going to attach to the base of the 3rd metacarpal here. All right. So the Extensor Carpi Radialis Brevis, if it contracts, right, it's going to pull the wrist this way, right? It's going to help you extend the wrist. So we've got our Extensor Carpi Radialis, because it's on the radial surface, brevis. The next muscle attached to the common extensor tendon is a big, broad muscle that then has tendons that go out and attach to all 4 of the non-thumb digits. So this muscle is aptly named the Extensor Digitorum. So all of these tendons are attaching to those extensor expansions of the digits, and so the Extensor Digitorum is going to extend, right, these 4 digits for us. You can see when you do it on yourself, you can see those tendons popping up, right? Those are the 4 tendons of the Extensor Digitorum. Now sometimes you want to be able to extend just your pinky finger, right? If you're going to drink tea. So we have a muscle just for extending the pinky finger, and that is called the Extensor Digiti Minimi, right? Which is one of my favorite names ever of any muscle. So we have the Extensor Digiti Minimi here. All right, so this is also why it's easy for us to extend just the index finger or just the pinky finger, but it's very difficult, I shouldn't do that one, to extend just either the 3rd or 4th digits. You have to fight by trying to flex at the same time. It's very difficult, right? Because they don't have their own separate muscles, but these 2 do. All right, so our 4th and final muscle that attaches to the common extensor tendon is the Extensor Carpi Ulnaris. So Extensor Carpi, because it's of the carpal bones or the wrist, ulnaris on the ulnar side. And so this one also attaches to the common extensor tendon and comes down and attaches to the base of the 5th metacarpal. So it's crossing the wrist just like the Extensor Carpi Radialis Brevis does. So the Extensor Carpi Ulnaris will extend the wrist in an ulnar direction, right? Because it's going to pull on this part right here. Okay, we are almost done. So really quickly again, common extensor tendon, we have Extensor Carpi Radialis because it's on the radial side, Brevis, Extensor Digitorum, Extensor Digiti Minimi, and Extensor Carpi Ulnaris. We only have 2 muscles left. These muscles attach up on the humerus above the lateral epicondyle. And the first one is the Extensor Carpi Radialis Longus, right? So this was the Brevis, this is the Longus. Now the Longus is going to attach down to the base of the second metacarpal. And here's where I have to show you that interesting landmark that I mentioned. So this, the tendon goes underneath these muscles. Remember your apple of your eye ball muscles? It also goes deep to this tendon to get to the second metacarpal, right? But that one's down here. It's not so obvious. This creates a really recognizable landmark. So you've got your Abductor Pollicis longus and Extensor Pollicis brevis, and your Extensor Carpi Radialis longus, because it goes all the way up here, dives underneath those. Along with your Extensor Carpi Radialis longus is a muscle that's not an extensor at all, but happens to run along with the Extensor Carpi Radialis longus, and that is the Brachioradialis. It also attaches here above the lateral epicondyle, proximal to the lateral epicondyle. It comes down. It also dives under the apple of your eyeball, and it actually attaches to the lateral surface of the distal radius. So the brachioradialis doesn't cross the wrist, so it's not actually going to do any actions along the wrist, but it does cross the elbow. So since it goes from here to here, and all the way down to the lateral surface of the radius, if it contracts, it actually flexes your elbow. So the brachioradialis is physically present and visible on the posterior surface of the forearm, but it is not an extensor. It's actually a flexor of the elbow. So there we have it. I'm going to go through everything and kind of dissect down if you want another review. If you don't, you can stop now. So here's our brachioradialis, named because it goes from the brachii, the arm, down to the radius, crosses the elbow joint, is a flexor of the elbow joint, and dives underneath the tendons of the apple of your eyeball, Abductor Pollicis longus, Extensor Pollicis brevis. Along with it is the Extensor Carpi Radialis longus, which is going to help extend the wrist in the radial direction. All right, then we have our common extensor tendon with the 4 muscles that attach there. Extensor Carpi Radialis brevis, also extending the wrist in the radial direction. Extensor Digitorum with its 4 tendons. Extensor Digiti Minimi, and Extensor Carpi Ulnaris. There. So if I remove those, we can see our Anconeus here, our supinator there, and our 4 deepest muscles, the Abductor Pollicis longus, Extensor Pollicis brevis, Extensor Pollicis longus, and Extensor indicus. Now you may have noticed that I haven't done any nerves or blood vessels, and the reason is there are very few nerves and blood vessels present on the posterior surface of the forearm. In fact, at most, what you sometimes will see, in terms of if we're just sticking to the big ones, is the radial nerve sending a branch out here to the dorsal aspect of the hand. The radial nerve is also innervating all of these muscles, but those branches are coming from deep within, and it's not very large in this region. All right, so there we have it. Muscles of the posterior forearm, all of which are extensors with the exception of brachioradialis, which happens to be hanging out in the neighborhood, but is a flexor of the elbow. I hope that was helpful. Let me know if you have questions.